I'm Jeff Glore, and this is CBS News.
The following is a paid program and does not necessarily reflect the opinions of the staff or management of Visionary-related entertainment.
Aloha and welcome to Maui Nonprofit Notes, the weekly radio show where you'll find us talking story with Maui's nonprofit executive directors and staff to find out how they're working to support the needs within our communities. Maui Nonprofit Notes is generously sponsored by Pacific Source. If you're building or remodeling a home, please stop by Pacific Source's cabinet and appliance showroom located in the Waikapu Bayshard. I'm Susie Tiemann, Executive Director of Lokahi Pacific, and your host for Maui Nonprofit Notes. During this hour, we're going to share some of the experiences of a nonprofit agencies and just how they're changing lives, changing communities, and creating miracles of hope for those with needs. We're starting off today's show talking to some folks from Malama Maui Nui. We're talking with Sarah Bryan, who's the Vice President of the Board of Directors, and Anna Leading, who is the Program Director. Cool. I can't do that to what's her name?
Well,
the director.
Well, I'm the stand-in right now because Gabby is on vacation.
Okay, so okay. We're gonna take over for Gabby while she's gone. She's due back next week though, isn't she, or something?
Yeah.
Yeah. Hope she's had a good vacation.
I think so. She went to New Zealand, did a kayaking trip downriver where she gave me the dates and is like, I'm absolutely unreachable right now. So good for her.
Hey, now that's confidence in your staff to be able to do that when you take off. Go someplace where they cannot reach you, period, at least for some period of time. Mm-hmm. Cool. Well, I hope she's having a good time and comes back all rested and raring to go, especially with this big fundraiser you've got coming up here in a couple weeks.
Yeah, I know. Well, fortunately, mostly everything will be done, I think, by that point. So she'll just get to come in and have the most enjoyable, delightful evening with all of the staff and the board and our community members.
Cool. Hey, that's a great way to put it. She gets to come in and enjoy it. Mm-hmm. Okay, and this is your first annual.
Yeah, yes. And I will let Sarah take this one over because she...
Is she honchoing this?
Yes, she is.
Well, we've been an organization since 1982, and we've had a lot of amazing people, not only on our board, but on our staff and over these years, and we've really never done this kind of a fundraiser before. And so I think, first of all, that's pretty amazing that we've been able to be an organization for that long. But also, we wanted to do an event where we could kind of reconnect with the community. I think a lot of people might have heard of our name, but maybe didn't really know what we do. And so we're also trying to sort of shift our focus. A lot of people know us as sort of the cleanup crew, right? We go and pick up trash and we do beach cleanups, and that is true, but we want to really shift the focus towards more of empowering the community to do stewardship, not only with us, but without us as well. And so the Hukilau is the name of our first annual fundraiser, and we loved the idea of the Hukilau, where we all have to pull together, we all share in, the bounty of what we've uncovered, and learning from each other, being a bigger part of a community. And so, we've got this amazing fundraiser February 2nd from 6 to 9 p.m. It's going to be at the Maui Ocean Center. And, if you've ever been to the Maui Ocean Center at night, it is amazing. It just feels like going to Disneyland or something. It's so magical, and all the lights are so pretty. And so we're really fortunate that they were willing to partner with us on this event. And we're just really excited because, like I said, we've never done this before, and we really want to try to make this an annual thing where we can all get together and sort of celebrate what we've accomplished in the last several years. So that's where we are.
And I love you're calling it an exclusive family night.
Yeah, well, it's hard to do something at the Ocean Center without wanting to bring your kids.
Right.
I have a 2-year-old, and we have an annual pass, and I think we go like every 2 weeks. And so, it really is. that location in particular is great for having your family there. It can be difficult because it's at night, and I know, my kid goes to sleep pretty early, but it's definitely a good place for that, and it'll definitely be family friendly. So, yeah.
There you go. So now, is the fee that you're talking about, is that for the family?
It's per person.
Oh, it is? Okay.
Yes, so it is $150 a person, so that may be limiting for you to be able to bring your kids.
Okay. Is there a certain age group that's free, or?
We're actually working on that with the Ocean Center. We don't know that yet.
Okay. Gotcha.
So if you have kids and you want to bring them, please just get in contact with us, because we're trying to figure that out, because we do realize that is a lot to bring a small child for that much money. So, but it does include a buffet dinner. We're going to have some music during dinner. We're going to have an awesome silent auction with some volunteers from the West Side that are helping us with that, and then there's all the exhibits. I don't know if anybody's been to the Maui Ocean Center recently, but the Kaho'olawe exhibit just opened.
Oh, did it?
And it's amazing and
Great.
beautiful. So we're really excited that people will be able to see that at our event as well. So.
I know people who've been by there who saw it being built. Mm-hmm. What is that they're putting down there?
Yeah, I don't think the new whale thing is going to be open yet.
Oh, okay.
I think they're still working on that, but there will be some new exhibits that are brand new that people probably haven't seen. So that's another reason to come out.
Cool.
Besides us just being wonderful and you wanting to support us, there's also the amazing Ocean Center. So.
Right, and I think that's an important part of this. Is it sounds like a lot of money, but you're supporting your program, which has done so much for us here on this island. I look back at the executive directors before Gabby and the progression of this organization, starting out as the Keep America Beautiful program participation from Maui, and then became Keep the, what was it, Hawaiian Islands or something?
Community Workday
and
program.
then Community Workday picked up,
Yeah.
And
yeah,
it's just
been a long road.
Yeah, and doing things that seemed to be important at the time, and then kind of shifting from that to the main core, which is actually the cleanup. And I can't imagine driving around this island without having you guys out there.
Thank you.
Working with the community members. And I think one of the things I'd like to maybe kind of emphasize today, if I can, is the idea of other groups getting involved. Whether it's your office or your business or your family, instead of just going to the beach for a family picnic, hey, call you guys and get the equipment and tools you need to go out and do a couple hours of cleanup.
Yeah, absolutely. And it can be as small as your family of 4. We'll provide all the materials that you need. You don't need to go get your own gloves, your own trash bags. We actually use donated grain bags from Maui Brewing Company, and that's what we give to all of our volunteers. They're quite sturdy, so if you pick up anything that is pokey, it's not going to poke through and rip that bag. And even then, larger organizations, you can have some corporate social responsibility, and depending on our involvement, it will be anywhere from you come pick up the supplies and from beginning to end it's all on you, but we give you the map, we give you the outline. Where do you bring it when you're all done? Where do you bring a tire that you perhaps found, or heaven forbid you find a refrigerator on the beach if you're doing a beach cleanup.
You'd be surprised what people have found. It's pretty amazing and horrible.
I remember somebody found a mattress or something on the beach, and we talked about that.
Those are relatively common, actually.
Are they really?
I personally have done a bunch of cleanups where I've found mattresses and blankets, and where just all kinds of stuff. I found a whole couch on a beach one time. I don't know if somebody was happy setting up a sunset spot. I don't know, but that's not the kind of thing we need to be having on our beach for sure.
Interesting.
Well, and what Anna's saying too, I think is so important, because I don't think people realize the impact that they're having when even if it is just your family doing it. In the last fiscal year, all of our cleanups, we collect the number of trash that we pick up, and Anna was just telling me before the show that we had over 500,000 pounds of trash picked up last year. 500,000 pounds of trash on Maui. Imagine if people weren't doing that, if they weren't picking that up, these community members doing that. And I don't even think we all realize how much is out there. And so I think that's kind of where we're trying to move our organization to, right, is not just going and picking it up, but why is it even there in the first place? And how do we prevent it from being there to the point where maybe one day we work ourselves out of a job?
Wouldn't that be nice?
And, but that's really where we want to be, right? We don't want to have to be going and doing cleanups. And so, but just you and your family even going out, picking up, it really makes a big difference. And imagine if you got your whole company to go out one day and pick up, or sponsoring, one of our big cleanups every year. We do a couple really big organized cleanups, and those are really amazing what we come up with there, because we've kind of planned ahead of time, like, oh, we know this area is really bad right now. We need to get a bunch of people out, and we'll get 50 people out that day, so the impact is really large. And I think that's another reason why we're doing this event, is to really showcase the impact, and the impact that the community members have been having along with us, because it really is, a group effort. It's not just our staff doing this at all.
Right. I keep thinking about things like when you said, that there would be no trash out there. It's like, why is it so easy for people to just kind of open the window and throw it? Or just let it fly out of the back of the truck and ignore it, or whatever.
Yeah.
I keep thinking about shows like some of these lottery shows where they say, oh, when they saw the number, it was like, that's my number. And then they dig for the ticket and they find it in their truck, in their stash pile. And I think, you could have thrown that out the window, hello.
Yeah.
Well, and one of the other things is, it's easy to do that, but it also can be hard to do the right thing on our island with the infrastructure that we have set up right now. Being, if you work a Monday through Friday 9-to-5 job, and the places that you can bring your refrigerators, your tires, and all of that are open Monday through Friday with one Saturday maybe, it's like, well, now what? And so perhaps that's a different conversation to have. And feel free, everybody listening, to call up that county council member and say, hey, look, I work Monday through Friday.
There's got to be a better way.
When is it open Saturday, Sunday? And one of the events we do on the west side, actually this weekend on Saturday, is our Go Green event. And it's been going for about 3 years. And from 9 to noon, we have our setup at the Lahaina Cannery Mall, where you can bring, for free, a donation would be delightful, but for free you can bring your appliances, you can bring your tires, you can bring your lead acid batteries. And, we bring big roll-off containers that the semi-truck has to bring for us, and we pretty much fill those every month. But it's just incredible to be there for the community.
And that's in Lahaina.
Yep, so that's Lahaina Cannery Mall. We partnered with the Lahaina Sunset Rotary and 5A Rent-A-Space, and of course the Cannery Mall allows us to set up in their parking lot.
Sounds like we need some other malls to get on the bandwagon here and maybe create something in their parking lot, huh?
I mean, just from my cruise perspective, when we do when we go to the west side and do our roadside cleanup, they come back and they're like, oh, that was easy. There was nothing out there.
It's really made a dent in what we find on the side of the road and in gulches and things like that. So we do think it's a pretty successful program. It's funded through the county. They've been funding that for us, but it actually does cost a lot, because the roll-off containers are pretty expensive, and then we have to pay. I don't even think people realize the waste, like the life cycle of waste here on Maui has changed a lot in the last couple of years. That's kind of why, like, you can't recycle everything that you used to be able to recycle. We used to ship things to China, and now we can't ship as much to China anymore. And so even just what we do with those items that we collect, we actually have to pay to have those items disposed of properly, instead of just you can't just throw stuff like that in the dump,
Right.
So And so it does cost a good amount of money for us to host that event, but it's better than seeing it in a gulch, right? Or
Right.
just on the side of the road and having Freon leaking out or something nasty leaking into our environment. So we're willing to do that work and to, make sure that happens. But yeah, there is a significant cost in running that program. And so we would love to see it in other places too. But again, it goes back to, is that really what we as an organization should be doing? Or should there be a better infrastructure countywide set up to pick up that stuff on a regular basis?
Right.
So that, a little organization like us isn't having to organize that every month.
That sounds like a good question to bring up. You're right. On that note, we've got to take a short break, and we'll be right back.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in Central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we are back. This is Maui Nonprofit Notes, the weekly radio show where we talk story with our nonprofit organizations here on Maui to find out what they're doing to help their clients. And, of course, the group we're talking to right now, Malama Maui Nui, formerly known as Community Workday, I think we're all their clients.
Yeah.
Aren't we? I mean, anybody who creates trash and doesn't dispose of it properly.
Well, we think, most people probably are trying to do the right thing and are trying to dispose of it properly. And that's part of our gig, too, is sort of trying to let people know how to dispose of things properly because, sometimes information can be harder to find and it changes, like I was saying earlier about the changing, life cycle of trash out here. And so if you want to, know the latest, best things to do with your products, then that's one of the pieces of information we provide.
Right.
And we also are really trying to be a resource for people that want to reuse products or want to try to make something else out of the trash. We have this great Art of Trash program that we do every year. It's literally we call it the Trash and Show.
That's in March, yeah?
April?
March or April?
It's the opening day is April 12th or 13th, whichever one of those is a Saturday.
Yeah, but we'll
April
do
12th.
April 12th, yeah.
We'll do workshops ahead of time to help people, get creative with the trash that they found and try to, figure out something else to do with it besides just putting it in
Right.
the dump, So
That's always such a neat event. People are really creative.
So creative.
We have, so last year we had over 7,000 participants. People come to view the gallery, come to the Trash and Show, enter their art pieces, and I'm actually just putting up on Malama Maui Nui's website some information if you want to be an entrant. And there's just a form, and you come and you do everything at the Maui Mall, and that'll be on April 12th. And yeah.
Cool. And it's open for 3 weeks or something.
Yes.
Yeah? Mm-hmm. Where people can come and view.
Mm-hmm. And but that goes back to what we're doing with our trash and the realization that we are in this huge global market, and you don't really realize things are changing until it's that blank moment.
As compared to an aha moment.
Yeah, exactly. Where all of a sudden we're like, oh wow, that's where everything was going to China, and they said no, and now we have no backup plan. Mm-hmm. And kind of we're trying to develop programs that will open up conversation about what are we going to do with this stuff, all of our plastics, all of these materials, and especially on such a small island in the middle of the ocean, one of the most isolated spots in the world, we're impacted, I think, even more.
Right.
Because we bring everything in, but we don't really ship anything out anymore, and everything costs money to be brought here, and then we have to spend money again to ship it out.
Right.
So if we can develop programs to just open that conversation, and we've got incredible people on Maui, really smart, really innovative entrepreneurs and artists that can look at our materials and possibly reuse it, remake it into something, and then maybe that's the middle ground to then stopping using some of these products.
Yeah, reducing the use at least. Yeah.
We did at one time have somebody who took plastics, and made picnic tables or benches or something here, but that kind of disappeared.
It's just really hard because if you set up a really large scale operation and then perhaps China brings back their recycling program, and then it all of a sudden becomes cost effective for them to just ship it out, then that large scale operation is obsolete. But if you can set up small scale, really interchangeable, modular, like you can adapt. A small scale thing is much easier than a large scale operation that, we've seen one of those go down recently, but I believe we have changes happening with HCNS right next to our office, actually.
Oh, right, yeah.
Yeah, so
Well, and that's really where we're trying to move to, like she was saying, is being a little bit more adaptable, even as an organization with our programs, because things are changing so quickly. And also we know that, as we know, like right now, like we're getting in a whole new administration. I mean, we've been really, really lucky. The county has really funded a lot of our projects, most of our projects, and they really understand the value of what we're doing. But you just never know what's going to happen, right? And we don't want to always, just be relying on the same, funding streams. And so that's also why we're doing the fundraiser, is trying to move towards more support directly from the community. And also, we were talking earlier, so we've got some new kind of innovative programs on the lineup that we want to be able to introduce, and we're still kind of in R&D in a couple of them, but they're really amazing and will definitely be shifting sort of the focus and drive of our organization. But also, we've been at the Space Yard in Pu'unene since the beginning of the organization. And slowly but surely the buildings are being condemned.
Right.
So also this fundraiser is going to help us start a fund to move our base yard to a new location, because in the next several years.
It's not imminent. Okay.
Not imminent, but we're at the point where we're going to have to do that soon.
I got you.
Yeah.
Do you still collect used paint?
We do not. We had to pare down that due to funding, but it's one of the top programs that we would like to bring back, and potentially with a docent service, community members manning it. And literally we get 3 to 5 calls per week.
People
about
loved
it.
That program.
Yeah.
And we have, it's not up on our website, but if you search the internet, you can find, Recycle Paint Maui, and it's a page, and it clearly says we shut it down. But I think, sometimes you just see what you want to see, or you're like, what?
Right.
But what do I do?
But it was such a good
Right.
program. I mean, because not only did you take what people had, but you were ready to give it back to somebody who could use it.
And
I came and painted my entire inside of my house from
There you
from
go.
Lum,
Yeah.
for free. I mean,
Yeah.
that's amazing to have a resource like that, and it was really nice paint. I mean,
Yeah.
that would have cost me hundreds of dollars to do that.
Right. Yeah, I know.
come to our fundraiser,
Yeah,
help us out.
help us out. Let's bring back the
Bid
paint
it-
program.
Bid on some amazing silent auction items, and it'll be that much closer to bringing that program back.
Right. Yeah. No, that's great. I just I admire what you do, and I'm glad you don't mind messing with trash. But talking about families getting involved with like roadside cleanup and beach cleanup. One day I was driving home, and I live up in Kula, and I was driving up Haleakala Highway, and I saw this what I'm assuming was a family unit like a husband and wife, or maybe two, like maybe sisters and their husbands, and then there was like 6 kids, and the kids were like 10 and above, and they each had their bag, and they each had their plastic
nice.
gloves on, and they were picking up stuff and putting it in these bags, and I looked at that and I thought, that's incredible. That's a story that needs to be told, because those kids have learned so much that day about the responsibilities of where you live and how to keep it the way it should be. And I just thought, gosh, I hope those parents are going to take them out for pizza or something afterwards to really reward them,
Yeah.
because they looked like they were having fun.
Yeah.
Oh, there's a piece, and then one would run over to it.
It's almost like a scavenger hunt,
Pretty
like,
much.
What are you going to find?
Yeah.
With the kids, they definitely get really into it. When we have the cleanups and they come in, it's almost like a quest to see, like, oh, who can get the most, or who can, fill up their bag the fastest, or so you can definitely make it fun. I know it's trash, but you can definitely make it fun. And actually, like, I find there's a lot of camaraderie in it too when we're out as a group, like, and everybody gets kind of fired up, like, why is all this out here, and then people are like, oh, I'm gonna go home and I'm gonna do better, and it does. It makes you realize, like, oh man, I don't want to use plastic straws anymore because I keep finding those, or I want to try to reduce my single-use plastic because that's what I keep finding out here,
Right.
And if we all just did a little bit, like I was saying before, it really adds up. You don't even realize how much it adds up. So
Yeah, very good point. Last minute comments. We got to call it quits here shortly.
I thought you were going to ask me a last minute question.
No, last minute comments.
Well, go to our website, www.malamamauinui.org. You can purchase tickets for our fundraiser there for the Hukilau, February 2nd, 6 p.m. to 9 p.m. We also have the ability to purchase a table, so you and your best 7 friends can come all and sit together. And we're also still accepting silent auction items. If you want to donate something awesome for our silent auction, you can get our contact info on the website as well.
Something that has started happening recently, and that is larger companies that have like divisions or departments, they buy a table, and that department and the employees and spouses or whoever get to come and use that table. And I think, wow, what a great way to support the community and also tell your employees you appreciate them.
Yeah. Yeah, it's a great reward, a nice evening out, to give your employees. So that's a great idea.
Yeah, I've seen that at a couple of fundraisers lately. And because I look at the group and I think, wow, that's an interesting group of people. And then somebody said, oh, they're the accounting department at such and such
Well,
company.
and we'll put your company's name on the table so people know it's
There you
So
go.
if you want to call us and let us know, or sign up on the website, we'll make it happen.
Yeah, well, it's an easy way to sponsor a night out for a crew that you appreciate.
Well, absolutely.
And we appreciate you guys. Thank you,
Thank
Anna
you so much
and
for having
Sarah,
us.
for being here and talking about what Malama Maui Nui is all about.
Thank you,
Thank
Susie.
you.
Okay,
yeah.
we didn't give a phone number.
It's 877-2524.
Okay, and then again, the website is malamamauinui.org.
Correct.
Great. Thank you so much. Hey, have fun with the Hukilau.
Thank you.
you.
See you guys
Okay.
there.
Well, yeah. Well, maybe. Gary and I always say we're going to go, don't we? That's our standard answer. We'll be there. Aha. Okay. Second half of the show coming up. We're going to be talking here with Mark Anderson of Maui AIDS Foundation. Hi, Mark.
Hi, Susie. How you doing?
You're kind of the new kid in the room here. How long have you been executive director now?
I started October 1st.
Oh, that long ago. What's
long
that?
ago.
That's 4 months.
Yeah, it's been a bit.
Has it been just a busy time getting organized and finding out what it's all about here
It
on Maui?
has.
Now, you've been with AIDS Foundation organizations before.
Yeah, I ran an organization that served northern New Jersey for about 10 years.
New Jersey.
New Jersey.
Oh, coming to Maui is quite a switch.
It is. I'm glad to see that there were fewer HIV cases in Maui.
Ah.
I was used to dealing with much higher populations. But yeah, Maui AIDS has been around since 1986. It started, at the height of the epidemic. We started off with all of our services being geared for folks who were living with HIV. That's still a big part of our organization, but we also have expanded into prevention efforts. So we do HIV training with police, with firefighters, with schools, with nursing departments, pretty much anyone who wants us out there. We provide PrEP services at Maui AIDS Foundation. So PrEP is a one-a-day pill that's highly effective at keeping people from becoming infected with HIV.
So that would be people with the HIV virus and those kinds of things.
No, this is people who are not infected.
Nothing.
No.
Oh,
and it
nothing.
keeps them from getting the virus.
Oh, okay.
So it's called PrEP. We provide that service. We have a family nurse practitioner on staff. We do STI testing. So that's things like syphilis, gonorrhea, chlamydia. So basically all in line with the mission of the organization, which is to promote the sexual health and well-being of the members of the Maui community.
Right. And now this is all confidential, right? All
Absolutely, 100% confidential.
Yeah.
Yep.
Nobody knows who you are.
Nobody
or who
knows.
that test belongs to.
Exactly.
I guess I should say. And it's quick.
Yeah. The HIV test is done within 20 minutes.
So no spending 2 days wondering what the results are. You can just sit right there in your waiting room and get the results.
Yeah, testing has come a long way. The modern testing is fairly quick.
Now, one of the things that I think a lot of people are confused about, and that is, who can have HIV? I mean, it's like
anybody you're looking at. Anybody. It's if you are sexually active, then being responsible for your health care, you should get checked at least once a year, just to be sure.
Right. And then there's if I remember correctly, there's also some time period where it may be starting to to happen in your system, but it may still show as being clear. If you have reason to suspect that there's something going on and you need to come back, 4 months later, 6 months later?
No, within about a 24-day period.
Oh, 24 days.
From infection to detection.
Oh, okay.
So, of course, the biggest thrust on Maui is to prevent new HIV infections. We have, a good number of clients that we've been working with for years. We unfortunately get a few new people every year. But a lot of our efforts are really targeted to preventing new infections.
Right. And you've got all these different groups. And I was looking at the list of your employees on your website. All these case managers, basically, to handle the different situations, whether it's youth, adults, people with, people without.
Mm-hmm. Yeah. So we have case managers working with folks who are living with HIV. We have case managers whose specific thrust is to go out and find people who have fallen out of medical care and re-engage them. We have case managers who go out to schools and all sorts of community organizations, and we run interventions. So we have support groups. On our website, you can find BRADA, SISTA. There's different support groups, especially with youth. Just teaching about HIV, education. Education goes a long way to prevention.
And are you seeing some results in your from over the past years?
Absolutely. Actually, we've just been looking at a 3-year trend, and the number of people we've been serving through our organization, whether they're folks living with HIV or folks that we're helping with prevention efforts, last year or this past year, 2018, we served almost 1,000 people on Maui.
Wow.
Yeah.
And is that a rise in the number of people you're serving, but the things you're doing are different? I mean, they're not all HIV patients. They're
correct. So like I mentioned, we've got our
prevention.
prevention efforts as well as our HIV work.
Right.
So one of our newer programs, we did kind of a pilot program in the state working with the correctional facility, Maui Correctional Facility. So that's been some good work.
Really?
Yeah.
You see some I shouldn't say positive results because you don't want positive results.
Well, we're looking not just at HIV, but hepatitis is huge. So hepatitis C, we've been able to help quite a few folks with that. And then again with STDs, STIs. When people get certain STDs, if they get gonorrhea or if they get syphilis, they're much higher at risk for HIV. So you want to start interventions then. Maybe that person would be suitable to go on PrEP at that point.
I see. Is the Hep C, is that curable?
Yes.
It is?
Yep.
Okay, but a lot of people try to ignore it. Is that what I'm understanding?
Yeah, unless people get tested for it, they just don't know.
Oh, okay.
So.
It's not an obvious illness.
Correct.
On that note, we got to take a short break, and we'll be right back.
See you
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in Central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we are back. This is Maui Nonprofit Notes. Today we're talking the second half of the show with Mark Anderson, who's the director of Maui AIDS Foundation, talking about the programs that they have and how many programs you have to try to prevent AIDS or HIV. And I think an interesting question was asked here during the break about what was her question? I can't remember. The stigma of HIV.
So in the whole HIV realm, stigma is huge. Stigma can keep people from getting tested for HIV. It can keep people from taking their meds. It can have a big impact on how people feel about themselves. So Maui AIDS Foundation is always trying to find new ways to break down stigma. One of the biggest areas that we can do that is through education, through our prevention services, getting out in the schools, getting out in the community, teaching people that it's a virus. Anybody can be infected by a virus, and giving you the tools to hopefully not get infected by a virus.
I know years ago there was a big scare about like blood transfusions.
Yeah.
And I think that's pretty much over now. I mean, they've gone through all the processes to make sure that the blood is safe that they're giving for transfusions and so forth. But for the people who did get it that way, I mean, it was a horrible thing because they were classified with the rank and file. And they didn't feel that was appropriate. And I know I'm getting into touchy territory here.
Yeah, I'm not sure where you're heading. Anyone can be infected with HIV. The whole, and sometimes. So you're suggesting that someone that, they didn't get infected intentionally. Well, no one gets infected intentionally.
Exactly.
It happens.
Yeah.
But another thing with stigma, the CDC reported about 3 years ago now that folks that are living with HIV who are undetectable, so that means they're taking their antiviral meds and their viral load is below a certain amount, they proved scientifically that these folks cannot pass on the virus.
Wow.
So between that and PrEP, which is highly effective, I won't give numbers, but it's not 100%, but it's darn close. So we have the tools now to end HIV. If we identify everyone who's infected, that means get your butts in and get tested if you're sexually active. It means if you're at risk for whatever reasons, if you have substance use issues, or if you have a lot of partners, get on the PrEP regimen. So we have these two tools that really, really could conquer the HIV virus.
Wow, that's fabulous.
Yep.
I think too the thing that when you look at the situation, I know as drugs were being developed for HIV, the expense of the drugs was an unbelievable thing for anyone who had HIV. Have those costs come under some reasonable?
Costs have definitely come down over the years, but more importantly, we know that we have to end the crisis. We know that we have to do something about HIV, all the way from the government level on down. So no one is going to go out without medications. It's just not going to happen in the U.S.
Oh, okay. So we have programs which help with the cost of it.
We do.
To make sure that people stay on their meds and on the regimen that's required.
Yeah, I mean, the government has made a commitment to end HIV, and part of that commitment is to make sure that anyone who is diagnosed gets into care, has treatment options.
Wow, that's fabulous.
Yeah,
that's enlightening, because I know that, and we're talking. I mean, when I say the cost of it, that we're talking 6, 7, 8 years ago, when it was so expensive, maybe a little longer.
Yeah, I mean, I don't know so much about pricing.
No, okay.
I just know that.
I know that we talked about it and said the average person could never afford it.
Right. We always have to be careful. Right now, there has been a movement with some insurers wanting to take certain HIV meds off the formularies, meaning that insurance companies don't have to pay for certain meds. We can never allow that to happen. We always have to be communicating with our legislators to let them know that a physician is the only one who can make a determination about what kind of meds an individual has to take, and that goes beyond HIV.
Oh yeah, we're seeing a lot of activity in the medical field these days. That's non-medical personnel making decisions.
Absolutely.
For all of us.
Mm-hmm.
So it's a scary territory, and we need to kind of pull those reins in and stay within the boundaries of our expertise.
We must be vigilant.
Yes, that's right. And AIDS is one of those. I mean, there's other things that I hear about from people that say the only way they got treatment was to go on this experimental program. It's a test. And they said, we really would rather go on the one that's proven, but we can't afford it. And so the only way to get at least, hopefully, some relief from the disease or illness was to go to this experimental program, which is twice as long, and it's unproven. That's why it's an experimental program. But then when you think of the other side, if it works, you've just helped the next generation and going forward with another drug that can be used for what you used it for, and that will have proven results down the road. Medicine. Oh, don't get me started.
Yeah, let's not continue to go there.
And insurance companies. Let's not get into that. But what you guys are doing, I mean, this is pretty exciting stuff that you've got going on with the prevention. I mean, that's focus number one. I love that.
Absolutely.
Now, over in your office, you also have some other services that you provide for your clients. You've got a food pantry for those.
We do. We have a food pantry. We have case management. We have a nurse on staff to do medical case management. We do linkage to medical care. We help people get their medicines. We try to be a one-stop shop, whatever people need.
Right.
If they need a ride to their doctor's appointment.
Oh, really?
Yeah.
Whoa, you guys do a lot.
We do, and actually just last week, a number of the staff and I were fortunate to be able to join in the Hawaii Department of Health on Oahu for the Hawaii to Zero conference. So they did a Thursday, Friday deal, Hawaii to Zero, and a harm reduction day. So, the state is very committed to getting to zero new infections on Maui.
Wow,
and the
state.
And in the state.
All around the state.
Yeah.
So that was the Department of Health that put that on?
It was.
Yeah. And any real big announcements or enlightenments that came out of it? Or?
That the state is committed to continuing to work on zero new infections, so that's part of the funding process, the organizations that they fund for the services that we can provide to accomplish those goals. Along with the prevention efforts for folks that are living with HIV, there's a continuum of care. So it starts with diagnosis and then linkage to medical care, and basically the cascade goes to the end goal of being virally suppressed, whereby the person cannot pass on the virus. So that's the goal. That's what the state looks at. That's what the federal government looks at. We're looking to have that kind of an outcome.
In general, are the numbers being reduced as a result of all this preventive activity? The numbers of new cases
In Maui?
Maui and Hawaii.
Unfortunately, nationwide, we have seen a slight decrease in HIV, but no steep graphs pointing downwards, unfortunately. And there are areas where HIV infection has stayed relatively constant, and then areas like the southern U.S. that are kind of the center of the epidemic right now.
Wow. And I know at one point there were a lot of people who thought, because we're such a tourist area, that some of our count was not necessarily Maui.
We have a population that we know of that we are case managing and dealing with regularly. There are quite a few folks that don't necessarily come through Maui AIDS Foundation. One of the great things about case management, the State Department of Health just did a study this past year, and I don't remember the statistics, but it showed that in general, folks who are case managed have much higher health outcomes, stayed linked to care, become virally suppressed.
The moral of the story is, don't just find out you have it and start taking pills. Be a part of the program.
At least check out the program to see if it's something that would be good for you. At least know about Maui AIDS Foundation. So if you ever need us, we're there. We're happy to talk with anybody.
And how do they find you? What's your phone number?
Our phone number is 242-4900, and Maui AIDS Foundation is located in Wailuku. Our email address is mauiaids.org.
And your website?
Is mauiaids.org.
Did you just say
that?
Yeah,
I did.
Hello.
It's okay. I got to say it twice.
It bears repeating. It's mauiaids.org. That's great. Now, you've got a big event coming up, which is part of your annual...
We do. So a lot of our funding comes through grants and whatnot, but we have areas that we have to come up with funds. And our premier fundraiser of the year is Maui Mardi Gras. We've been doing it for years, and this year we are having it at the King Kamehameha Golf Club. It's going to be on Saturday, February 23rd. So tickets for the King's Feast that goes from 6 p.m. to 1:30 in the morning are $140. We also have an after party starting at 9 p.m. that folks can buy tickets for. That's $20 or $30 at the door. And we welcome sponsorship. We do 3 sponsorship levels. $2,500 is the first level. The Queen Crew level is $5,000, and the King Crew sponsorship is $10,000.
Oh.
All of these funds are used for our services and go back to the folks that we're serving.
Tremendous. And King
Kamehameha
Clubhouse. And it's come dressed. I mean, come prepared for the masquerade.
You can come however you want.
Oh, okay.
The
traditional walking shorts and...
we have folks that get all decked out in costumes. It can be a lot of fun.
Yeah.
We do masks and
now,
beads and all sorts of stuff.
Is this right around the time of the Mardi Gras?
It is. I think we're within a week or so.
Yeah, and Fat Tuesday and all that kind of stuff.
It's not always necessarily around the same time, but we've been doing this for years. Maui Mardi Gras, I think it's pretty well known on the island, and we welcome anybody who wants to come and have a good time and support Maui AIDS Foundation.
And there's an auction?
Yeah, we have a silent auction. There will be a live band and for entertainment. There will be a DJ for the after party. I think I've hit it all.
Whoa, it's quite an event.
It is. We started planning for it over a month ago, and it's on February 23rd. There are still tickets available, and we hope to see you there.
Great. Anything we missed? We got just a minute here to wrap it up.
Just a minute. Maui AIDS Foundation always welcomes volunteers, and we're looking to just continue to serve the folks in Maui. Aloha.
Well, it sounds like you're doing a great job, and when you come into town, Mark, but you'd been here before.
I've been coming for 23 years.
Yeah, this was vacation time for you before, but
the
now
first time I ever came, I went to Iao Valley and had a spiritual experience and knew I would be on Maui one day.
Did you really?
It just took a while.
Yeah, well, sometimes it's worth waiting for.
Yeah.
Yeah, the everything converged and it was time.
It was.
That's good.
I love being here.
Welcome to Maui, and it sounds like you're enjoying being here, and you certainly have got your plate full of things to do.
I do, and I'm telling you, it's just a great team of folks at Maui AIDS Foundation. They're a pleasure to be with, and it's our work ohana that wants to really make a difference on Maui.
Yeah. That's we get to work with some of them from time to time because you're in our building, and we appreciate that. And as you say, it's right here on Main Street. So come and get checked out. And I think that's a good point. Don't hesitate. Find out.
Yeah, don't wait. Early detection means everything. It means you get on meds, you get undetectable. Your life is good.
There you go. Yeah, and that wasn't the case 20 years ago.
It was not, but things have changed.
Yeah.
So again, MauiAIDS.org.
Very
Mahalo.
good. Thanks, Mark.
Thank you.
Maui Nonprofit Notes is sponsored as a community service by Pacific Source, the builder's choice. Give Paul and his staff a call at 986-0380 or stop by their showroom in the Waikapu Bayshard on East Oahe Way to see how they can help you with your building project. The Maui Nonprofit Directors Association's purpose is to provide an opportunity for nonprofit agency directors to gain personal and professional support through cooperative development activities. Maui Nonprofit Directors also provides an opportunity for networking to affect significant positive change in our community. Please visit our website at mauinonprofit.org for a list of member agencies. You can also check it out for a list of our radio shows because they are up there for you to listen to. If you missed one that was with some agency that you wanted to learn more about, each radio show has listed who the two agencies were that were featured that day. So today we visited with the folks from Malama Maui Nui and found out what they're up to, and we also visited with the folks with Mark from Maui AIDS Foundation. If you heard anything today that makes you want to get involved, please check with these agencies and find out more about their programs. Aren't you going to start the music pretty soon?
A couple seconds.
Usually by this time you're pushing me. Did I start too early?
You did.
Oh my gosh! See, that's what can I say? We always have this thing about when I finish, it's like how many seconds did I leave? And it's like I there's supposed to be just so much music, and what is it? 30? No, it's more than 30.
1 minute.
It's a minute of music. Okay. And so it's the timing is just incredible. Sometimes I have to jump to the last paragraph. Other times I can ad lib, which is what I'm doing right now, and I'm probably going to run out of time. We want to thank you all for joining us. Don't forget to come back again this way next week and listen to us again on KAOI Radio, 11:10 a.m. on the FM dial at 96.7, 96.5, or 98.7. We'll feature representatives of two other member agencies of the Maui Nonprofit Directors Association. Until then, I'm Susie Tiemann, Executive Director of Lokahi Pacific, and your host. Hey, thanks again for joining us today. Have a great week, everyone. Aloha.